Hi everybody, Dr. Ahles here. In this short video, we're going to talk about how we take the urine that we made in the nephron and get it all the way down to the bladder, at which point we'll be able to release it out of the body using a process called micturition. So let's start with a quick review of how we made that urine. Remember that the functional unit of the kidney, what makes the urine for us, is called the nephron. So remember that fluid goes from this beginning portion, the renal corpuscle, into what's known as the proximal convoluted tubule, the close twisty tube, down into what we call the nephron loop, where we exchange salt and water. Ultimately, we end up dumping into the distal convoluted tubule, where we travel into the collecting duct. Now, here's an important note for us to make for ourselves. The collecting duct is the last structure that I can modify what I'm making. By the time the fluid drains out of the collecting duct into these other structures we're going to be talking about, at that point I can't change it anymore. So all of the modifications have to be done by the time we leave the collecting duct. What comes out of there is technically now finally urine, and that urine can't be changed anymore. So we've made this urine. We've released it from the collecting duct. Let's talk about where it's going. Place number one, those things called the minor calyces. Remember that each of my dark renal pyramids has their own little tube, their own calyx that we dump this urine solution into. Those tubes fuse together to make these larger major calyces. Ultimately, the major calyces drain into this big interior portion known as the renal pelvis. The renal pelvis is collected to that tube that's on the outside of the kidney, going all the way down to the urinary bladder, the ureters. And there's two important things that you want to make sure you know about the ureters. Thing number one, they're lined with transitional epithelium. Remember from A&P1 that transitional epithelium is the kind of epithelial tissue that can change its shape or can stretch depending on the volume that's inside of an organ. So your ureters are actually able to expand and contract depending on how much urine they're transporting. The other important thing about our ureters is that they're made of smooth muscle. Remember that smooth muscle is not consciously controlled, but we use it in places like the digestive tract to do something called peristalsis. Peristalsis is the involuntary movement of things inside a tube. So when we're thinking about the way that the ureters transport urine from the renal pelvis region down through the ureters into the urinary bladder, we're using this unconscious contraction method called peristalsis to get that urine down to the urinary bladder. When we get to the urinary bladder, we're actually going to enter using these ureteral openings, just little holes for the ureters that are found on the back side of the kidney. So it's hard to see in my picture here, but that ureter traveled down behind the urinary bladder and went in at this opening here in the back. So I have one ureteral opening on this side, one that's hiding on the other side, together with the place where I'm actually going to release the urine from the kidney called the urethra. We make up this region right here called the trigon. And so the trigon has smooth muscle tissue that's organized a little bit differently than some of my other bladder locations. That's because this is going to help funnel that fluid down through the urethra to leave the urinary bladder. When we think about the bladder, this is an organ that can substantially change its size and its shape, depending on how much urine that you're making and how much urine you're releasing. So when the bladder is empty, a lot like the stomach, we see those structures called rugae or ridges. You can see them in my image over here, all these little squiggly lines. Those rugae will spread out as the bladder is filling. And when the bladder fills, it expands two directions. It's going to expand upwards into the abdominal pelvic cavity, and it's also going to expand out to either side. Quick connection to make for you. When a woman is pregnant, the uterus is actually sitting right here on top of the urinary bladder. That puts pressure from the top, preventing the urinary bladder from expanding upwards, meaning that a woman's bladder feels like it is full more often because it no longer has that ability to spread upwards. When we think about a normal full bladder in an adult, so not someone who's pregnant, not someone who's overfilled their bladder, it's typically a volume of about 16 ounces. So that's not a lot of fluid, about 2 cups of fluid. This is why throughout your day you're making stops at the bathroom pretty regularly, because this is the point where your body says, hey, we need to void the bladder, or we need to release the fluid that's here inside. So let's talk about that process of releasing the urine from the bladder. Technically, this is known as micturition. So micturition, the process of emptying your bladder, or like I mentioned, the other word for it is voiding. When we're voiding or emptying our bladder, this is something that technically starts with a subconscious reflex. Remember that reflexes are things that happen all on their own. You don't control them. With every reflex, we have a stimulus, what makes it happen, and we have an effect or result. So as your bladder starts to stretch out, the smooth muscle inside of it, called the detrusor muscle, detects that stretching. That stretching sends information to the spinal cord. The spinal cord primarily regulates this reflex, although we do also send some of that stretching information up to the pons of the brain. Now, the pons has a couple of different centers or a couple of different places that help us decide what to do. So I've got this stretching information that's coming from my bladder. As long as the fight or flight division, the sympathetic division, isn't activated, as long as it's down, or if my rest and digest division activation is up, both of those things will encourage me to contract the bladder muscle called the detrusor, and also help me to relax what's called the internal urethral sphincter. The internal urethral sphincter is made out of smooth muscle, as is the bladder. So the detrusor muscle that makes up the bladder and the internal urethral sphincter are regulated primarily by this spinal cord reflex. But remember, we sent some information up to the pons as well. Depending on whether we are activating the pontine micturition center or the pontine storage center, that's going to help us decide whether we will actually empty the bladder or whether we're going to do our best to hold it for later. So we have some conscious control over this micturition process. The primary mechanism that we have to consciously control this is called the external urethral sphincter. The external urethral sphincter is made out of skeletal muscle. And once you've written that word skeletal, I want you to underline, highlight, star it. Skeletal muscle is the kind that you do consciously control. The detrusor muscle, as well as that internal urethral sphincter, those are smooth muscle. You don't get to decide those. So when we decide that we're ready to empty our bladder, we have to relax this skeletal muscle making up the external urethral sphincter. As we consciously relax that, as we decide that we're ready for this process of micturition to begin, then we'll be able to void the bladder and relieve that pressure that we see from the bladder wall stretching.